And then finally, what we need to do is to ensure that there is tracing. And that tracing is about helping to find the cases in the community. Now, public health officials have been doing that manually, and today we're expanding that capacity with the CovidSAFE app. I'll briefly explain its purpose and how it operates. In terms of its purpose, it's very simple. It's to protect our nurses and our doctors, our families, our friends and ourselves, by providing early notification if we've been in contact with somebody who may have been diagnosed as positive with coronavirus. And it's very possible that we would never know. And there are over 500 cases in Australia where we've never found the original source. And it may be that two people have been standing in a line and one of them had accidentally been a little bit close. They might have been on public transport together. The names are not known, and you would not be able to find that person and notify them that they're at risk. And they in turn might be in contact with a doctor or a nurse. And that's how an infection can get into an aged care centre or a hospital or some other form of health environment. So against that background, the Australian government, in partnership with the medical community, has established the CovidSAFE app. And what it does is that it assists in the early alert and finding of people who may have been in contact with a person that is positive with a diagnosis. How does it work? Very simply, download the app from your app store. It could be the Google App Store, it could be the Apple App Store. Subsequently register from 6 p.m. today. You then have your app open. It provides a Bluetooth handshake. It sits on your phone in terms of the data. That data is encrypted. No one has access to it, not even yourself, no Commonwealth officials. If you are diagnosed, then you already have voluntary consent for downloading the app, but you're asked a second time. Only a state public health official can be given access to that data, and only after you have then consented for a second time. It's then your details of whom you have been in contact with for more than 15 minutes with less than 1.5 metres distance will then be provided. In terms of privacy, no person can access what's on their phone. No other person can access what's on your phone. It's also prohibited by law. I've already signed in to law on behalf of the government a Biosecurity Act determination which prevents access, which ensures that the data has to be kept on an Australian server. It cannot leave the country. It cannot be accessed by anybody other than a state public health official. It cannot be used for any purpose other than the provision of data for the purposes of finding people with whom you have been in close contact, and it's punishable by jail if there's a breach of that. There's no geolocation, there is no Commonwealth access, and as I said, it's stored in Australia. Importantly, the data is deleted from your phone after 21 days. It's been assessed by the Privacy Commissioner, and there are only 4 things that are required from an individual. Obviously, your phone number, your name, your age range and your postcode. Significantly, we've worked with the medical profession, and the medical profession has released a joint statement with the government today, and that includes, and I'll just read them in alphabetical order, the support and encouragement for people to download the app of the Allied Health Professions of Australia, the Australian College of Nursing, the Australian College of Rural and Remote Medicine, the Australian Dental Association, the Australian Medical Association, the Australian Nursing and Midwifery Federation, the Council of Medical College Presidents of Australia, representing all of the medical colleges, the National Aboriginal Community Controlled and Health Organisation, the Pharmaceutical Society of Australia, the Pharmacy Guild of Australia, the Royal Australian College of Physicians, the Royal Australian College of GPs, and the Rural Doctors Association of Australia. What that means is today is about supporting and protecting our health professionals, our nurses and our doctors, and everybody who's taking care of us. It's about taking care of our families, and it's about taking care of ourselves, and it will help us as we seek to return to normal and the Australian way of life.